Good afternoon. I'm Alan Jobe. I'm a old-time neonatologist. When I started this business, there was no infant ventilators, and we have made remarkable progress with some of the diseases of neonatology, such as respiratory distress syndrome. But there's all these other unique diseases of neonatology: intraventricular hemorrhage, necrotizing enterocolitis, PDA, and et cetera. And they all ultimately impact the development of the brain and function. And unfortunately, we have very little insight into some of the pathophysiology of these other problems. So in the future, that's where the effort needs to be made. We have a couple of magic bullets in neonatology. We now have surfactant, so we could treat respiratory distress syndrome much more effectively than we could in the past. But we have no specific treatment for things like intraventricular hemorrhage. And one of the things that Dr. Martin just mentioned, which I think is really important, is we're beginning to learn that all of these things actually probably impact the individuals who survive throughout their lifetime. So this is the concept of the developmental origins of adult diseases. So we're concerned, particularly in the field, that we're actually generating a whole bunch of individuals who have a potential for late cardiovascular disease, lung disease, and a profile of the metabolic syndrome, which also predicts bad outcomes later in life. So this is a challenge for the future. We really have no insight about how we might think about trying to prevent some of those things. So for the future, we need people interested in the epidemiology of this and the molecular biology of this. Ultimately, the developmental biology of each of these diseases needs to be worked out, as does how to strategize preventing some of these diseases. Ultimately, we're tied to the obstetricians and the problems related to preterm delivery. And it seems that although there's been lots of ideas about how to decrease prematurity, none of those have turned out to be very productive. So one of my primary interests is in antenatal steroids. And my concern there is that although that's a standard of care now around the world based on the World Health Organization recommendations, the problem is we've been using the wrong drug at the wrong dose for 40 years because we had inadequate studies early on. It's an example in neonatology of a therapy that has become standard of care without adequate study. And so that's one of my areas of interest now. So we're working on that. And